going to need eyes to inspect, hands to percuss, hands to palpate, a stethoscope for auscultation, and a watch for second-hand timing. This is my patient. Hi, my name is Leah and I will be your nurse today. Can you state your name and date of birth?
Sure, Michelle Nolan, January 14th, 1967.
Can I please see your wristband? Checks out. 2 patient identifiers. Now I'm going to close the curtain and perform hand hygiene. Curtain closed, hands washed. Now I'm going to ask any pertinent questions relating to the abdominal assessment. Have you been having any stomach pain?
No.
What brings you in today? Okay. You're in here for a checkup. What brings you in today?
I'm here for a checkup.
Okay. Have you had any stomach pain?
No.
When was your last bowel movement?
This morning.
Great. And then I'm going to ask the patient about allergies. Do you have any allergies I should be aware of?
No.
Okay. At this point, I would offer the patient a gown if that is necessary. Then I'm going to ask for consent to perform the exam. Do I have consent to perform this exam now?
Yes, you do.
Thank you. The first step is to inspect the abdomen. The abdominal exam begins on the right side of the patient, so I'm making sure to start there. You are looking for the overall shape, scars, color, symmetry, and any unusual protrusions. Some abdomens are round, flat, obese, or even distended. A scar on an abdomen may indicate an appendectomy or cesarean section. Additionally, a yellow tint to the skin may indicate jaundice. Jaundice is associated with high levels of bilirubin in the blood. It is included in the abdominal assessment because it can be associated with diseases that of the liver, pancreas, gallbladder, and bile duct. Symmetry of the abdomen would show equal shape on both sides of the umbilicus. Lastly, you're looking for any unusual protrusions that should be noted and looked further into. For example, a hernia is an unusual protrusion that would require further attention. You should also note any stoma bags, tubes, drains, incisions, scarring, dressings, or medical equipment. In inspecting this patient's abdomen, you can see that there are no protrusions, unusual scarring, or jaundice. The next step in this exam is auscultation. The diaphragm of the stethoscope should be placed in each of the 4 quadrants in the order of right lower, right upper, left upper, and left lower, and listen to for 15 seconds each. You should also listen for bruits. A bruit is a normal swishing or blowing sound from the blood flowing through the narrowed or partially occluded artery. During an abdominal exam, you should attempt to auscultate a bruit over 5 structures: the aorta, bilateral renal arteries, bilateral iliac arteries, hepatic artery, and splenic artery. In this exam, I'm going to be auscultating over the aorta and the bilateral renal arteries. Because the frequency of hypoactive sounds is less frequent, you will need to listen a little bit longer in order to assess them. These sounds indicate that there is intestinal activity that has slowed, which is normal when a person is sleeping. Additionally, bowel sounds can be hyperactive with more than 30 bowel sounds per minute. Again, you will only need to listen for a couple of seconds in order to estimate this frequency. These sounds indicate intestinal activity that is quicker than normal. You will hear hyperactive bowel sounds after a client has just eaten, and these sounds may be associated with diarrhea and early to partial intestinal obstruction. Bowel sounds can be normoactive that are low-pitched and gurgling. They can also be hypoactive. These are less than 5 bowel sounds per minute. Here, I will auscultate the aortic artery. I I listened for 15 seconds, and now I will be auscultating the bilateral renal arteries. With no abnormalities found, I am moving on to palpation. I am palpating all quadrants deeply and feeling for masses and abnormalities. Now I am going to percuss the liver and feel for borders, as well as percussing the spleen. I am listening for dullness and changes in how it sounds. Moving on to the spleen. Here I am, starting in the right lower quadrant to percuss the abdomen. Next, I'm going to percuss the abdomen. Percussion of the abdomen involves tapping the body to elicit sounds and determining whether the sounds are appropriate for the underlying structures of that quadrant. This provides information about the overall consistency of the abdomen, as well as the size and borders of some of the underlying structures. I am going to start in the lower right quadrant and move around the abdomen. Here I am, starting in the right lower quadrant to percuss the abdomen. Now that the exam is finished, I will wash my hands and document any patient findings. An example of patient findings may look something like this. Abdomen is soft, symmetric, and non-tender without distension. There are no visible lesions or scars. The aorta is midline without brute or visible pulsation. Umbilicus is midline without herniation. Vowel sounds are present and normoactive in all 4 quadrants. No masses, hepatomegaly, or splenomegaly are noted. Now I'm going to palpate the patient's liver. Will you please take a deep breath? I'm going to do the same with the patient's spleen. Will you please take a deep breath? While I'm doing this, I'm going to ask the patient if she has any pain while I'm palpating. Patient, do you have any pain?
No.
With no abnormalities found, I am moving on to palpation. I am palpating all quadrants deeply and feeling for masses and abnormalities. Now I am going to percuss the liver and feel for borders, as well as percussing the spleen. I am listening for dullness and changes in how it sounds. Moving on to the spleen.